Hello, Thrive Nation. We've got the return of the paleocardiologist, Dr. Jack Wolfson. He's already been on the show. We'll put a link to that episode that got a lot of feedback in 2020. Welcome back to the show, Dr. Jack Wolfson.
Thanks so much, Steve. Pleasure to be on. And lots to catch up on. So thank you again for having me.
Absolutely. Now, Dr. Jack Wolfson is a board-certified cardiologist. He's a natural health cardiologist. It's incredible to go to his website and see, all the different types of speaking events. USA Today. He's been on so many different shows and podcasts. He's really is the trumpet and the voice of natural cardiology. I've had about 6 cardiologists on the show in the last 88 shows that we've produced. And it's always good to see that things are starting to turn in the cardiology world. Dr. Jack, can you just tell us what has changed in probably the last 18 months with regard to heart health? It's still the #1 killer in the US and in Western countries. It's the #1 non-communicable disease killer. So obviously in Africa, we've got other issues here with communicable diseases, but heart health should be the most important health that we should be looking after. What has changed in your world and in the world of cardiology in general?
Well, I think, listen, obviously the world has been turned upside down by the pandemic over the last 2 years. And what we're really seeing again is that really looking at the cause of why people get sick is more important than ever. So whether we talk about someone being at risk for a heart attack, a stroke, heart failure, atrial fibrillation, high blood pressure, or we're talking about people being at risk for cancer or brain diseases, or we're talking about people being at risk for viruses or bacterial infections or immune-related issues. It just comes back down to the foundational stuff, and those are items that are never going to change. Those are really the principal tenets that we as physicians should be espousing to the world, and the other cardiologists who you've had on your podcast, continue to espouse about, again, how do we become the healthiest version of ourselves? And that's how we're going to, attempt to survive on a toxic, polluted planet.
Okay, great. Now tell me, how important is it to have a look at a sort of a natural root cause? Because in the last 2 years in the pandemic, there's not been a politician, a health minister, from what I know, all over the world, who's spoken up to say, let's look at your nutrition, let's look at your exercise, let's look at your sunlight, let's get rid of electromagnetic radiation. And then there seems to be a divide between these natural health practitioners like yourself and myself and the political world and public health. There just seems to be such a chasm there that no one is standing up at all in the last 2 years to say, we need to look at the root causes. We need to look at cardiology health. We need to look at brain health. Is this a political public health problem, or where is this chasm in this divide?
Yeah, I mean, it's clearly become political. It is all corporatized, as medicine has been for over 100 years, since the Flexner report, sponsored by the Rockefeller Foundation, really changed the face of health as we knew it in the early 1900s, moving it from a wellness-based model to a sickness, pharmaceutical, surgical-based model. And I think really now is that we're just not seeing anyone, certainly on mainstream, talking about real strategies to stay healthy, because again, it's just mainstream media is bought and owned by corporations, including the pharmaceutical companies and the food companies. So now what you have is just a total vacuum where it's hard to get the truth out. So if we have a show like you and I are talking about right now, and we say, hey, there is fantastic literature about how high levels of vitamin D equals the lowest risk of the pandemic illness. People with the highest levels of glutathione have the lowest risk of the pandemic illness. People with the highest levels of omega-3 fatty acids have the lowest risk of the pandemic illness. And that's all in the medical literature. But again, it's just not, it's not talked about, because the only rhetoric they have, of course, are about things you can inject, pills you can swallow, procedures you could have done, and ultimately this global control of sickness. And fortunately, because of people like you, myself, and so many others, we are just awakening so many people to the reality that health will never be found at the tip of a needle or swallowing a pharmaceutical.
Okay, so let's look at the world of Dr. Jack Wolfson, and I really appreciate your time. I called your office. I know you're a really busy man with so many projects, and I love the fact that you've got health coaches on your website. It makes my heart smile because you're really involved in transformation. But in your world, what is happening with people's heart, disease? Is it increasing? Are people managing it better? Obviously, you're a person who on your website, natural heart, holistic health. Are people embracing this more? Is there growth and exponential growth of people saying, I do want to go to a natural health cardiologist?
I think there's a lot more of that, certainly, Steve, because people see their parents and their grandparents, and they see the sickness that's there. They see them swallowing all different kinds of pharmaceuticals and going in and out of the doctor's office and into the hospital. And more so than ever, I think people are trying to avoid that. This younger generation is really going to be gravitating more towards, again, the organic food movement, the organic lifestyle movement. And the more people, again, like you and I, that shout from the rooftops the way to real health, that's going to be the ultimate strategy. But, listen, the pharmaceutical companies, they are nothing short of some of the best marketers in the entire world. And when they market that message of, again, where, take a pill for every ill, it can make it, again, difficult for us to get our message out in front of people to say, no, we got to talk about nutrition. We got to talk about lifestyle. You mentioned over the last couple of years, again, like medicine really is not advancing in any way, shape, or form. They'll trot out a new pharmaceutical that lowers your risk by a small percentage according to their literature, which may or may not be true. And ultimately, it's just a matter of, we're not interested in taking a pharmaceutical to allegedly lower our heart attack risk, for example, from 5% to 4%. It's about how do we achieve the 0% category? How do we get the 100-year heart? How do we live well, live long? And again, it's not in their model. Their model is a failure. Their model shows that, longevity for people in the United States and in developed countries is around 80 years of age, and it's not advancing. So again, if we're looking to get that 100-year heart, it's going to be done just with the common sense approaches that you and I always discuss.
Great. Now, someone's listening, and I find, I've been a physician 23 years. It's very difficult to change someone who's possibly in their 50s or 60s on multiple pharmaceuticals. A lot of them have been captured through sort of just their medical doctors who are good people with good intentions, but almost caught up in this mass formation psychosis about pharmaceuticals, which I think has been, as you said, very, very well marketed. But someone's in their 20s or 30s listening, and they want to look after their heart. Maybe their parents have had a heart attack or heart failure, or their grandparents died of a heart attack. Give us your most important pillars of what a person could do right now, saying, I want to avoid the pharmaceuticals. I want to avoid having, the triple bypass. I don't want to have any issues with my heart as my parents or my grandparents do. What do they do now? They're in their 20s. They might have a little bit of finance now to use a bit of disposable income. Where should they start, Dr. Jack?
Well, the majority of my patients are, let's just say, for example, my average patient is in their early 60s, and they've already had a cardiovascular event, and they're looking to prevent another one. They're looking to reduce or eliminate pharmaceuticals and avoid surgical procedures. So that's really where, and I think there's a lot of people that are in that age demographic that they're opening their eyes. They don't like the way they feel on the pharmaceuticals. They don't like the in and out of the doctor. They don't like what's going on with their health, and they're gravitating towards alternative resources. And then, as you mentioned, also, we both love to speak to the younger generation and say, hey, you're in your 20s and 30s. Now is the time. The time to get healthy is on day one of life. And even actually while you're in utero, actually before you are conceived, the health of your mom and dad before, again, you're conceived plays a significant impact in the health of future generations. So that being said, again, the best time to get healthy, of course, was a long time ago. The second best time is now. And to that end, to answer your question, I think the number one strategy Really, again, we have a lot of different strategies, but let's say as it comes to food, obviously there's so many different arguments when it comes to food. What's the best diet? Again, I've got my opinion on hunter-gatherer or Paleolithic foods, and I believe that to be the truth. But that being said, no matter what diet you're following, make it organic. Get the chemicals out of your food. Nothing artificial, nothing synthetic, no GMOs. Limit your pesticide exposure by going organic. The literature is very clear on the dangers of pesticides, but quite simply, if something kills pests, it's going to kill us as well. And then, as you certainly talk about, we've got sleep, we've got sunshine, being physically active outdoors. All these things are all the strategies. And then you bring in evidence-based supplements to supplement the healthy lifestyle. And a lot of times that can be really dialed in based on some of the most advanced laboratory testing in the world that, as you know, we perform.
Yeah. Look, I want to push you a little bit, Jack, on the 60-year-old that's coming in, multiple pharmaceuticals, maybe he's already suffered with a heart attack. I mean, do they change? Do they follow your protocols? Do they get off the pharmaceutical? Someone might be listening out there and say, listen, I'm too far gone. I've had a triple bypass. I mean, what is your experience say about those people in their 60s? Can they really improve their heart health?
Oh, 100%, 100%. I mean, I see this again on a daily basis in my practice for the people who work with me, my other doctors, my other health coaches. People do tremendous. Now, I'm not going to say everybody eliminates all their pharmaceuticals, but the people that come to see me, again, they want to reduce and eliminate the pharmaceuticals safely and effectively. And we do that because when you give your body what it needs, then we can get the job done. We can normalize blood pressure. We can improve cholesterol levels, lower inflammation, oxidative stress. We do this all the time. And again, I feel our approach is for everybody, but some people are very scared. They're very scared to venture outside of the mainstream model. And there's also a lot of people, again, who just don't want to embrace this. They think that the pharmaceutical is all they need. I'll take a statin drug and eat whatever I want. I'll take an aspirin and eat and live however I want. Unfortunately, those are the people that are suffering most tremendously. But again, I think as we continue to get the truth out there, and as people wake up to again this pharmaceutical government takeover of our healthcare, that's where people again are going to start looking for alternatives, and we're going to be there to provide them.
Good. I'm going to sort of just get into the details of this because, I mean, you say you can lower your blood pressure. People can get off blood pressure medication. I mean, that is not a meme that's coming from the average medical doctor out there, the average cardiologist saying how important blood pressure is. If your blood pressure is high, the damage that it does cause. I mean, in South Africa, 50-year-olds and above, 80% have hypertension, Dr. J. 80% of people over the age of 50 in South Africa have hypertension. Okay. So you are saying that if they follow some strategies, we're going to talk about nutrition because I think it's important, from the carnivore diet to the keto diet to the paleo diet. I want to get into those. But are you saying that those people over the age of 50 can get off their blood pressure pills and make sure that their blood pressure is normalized?
We've done so very successfully with thousands of people. That's the reality. And again, the reason why, of course, high blood pressure is so prevalent is really twofold. Number one, quite obviously, is that it is in the pharmaceutical company's interest to lower the normal blood pressure number and make that as low as possible in order to label as many people as they can hypertensive and therefore sell pharmaceuticals. So that's one factor to look at. But let's take into account and say, okay, no, it is normal blood pressure of 120 systolic and 80 diastolic. And if you are significantly above that, well, then you're hypertensive. And certainly the higher your blood pressure is over the longer amount of time is linked to things like heart attack, stroke, kidney diseases, heart failure, death, you name it. So what we really want to do is that if we talk to people about best nutrition and the healthiest lifestyle and avoiding environmental toxins and chiropractic care, which is proven to lower blood pressure 17/10. Now we can start getting into strategies again that by living that optimal lifestyle through all these different things, now we can start to normalize the health and wellness of the individual person. And again, start to slowly reduce the pharmaceuticals for blood pressure. And we do it so easily when people follow the program. But as you can imagine, right, Steve, you know this, a lot of people, they don't want to follow the lifestyle. They don't want to go to bed on time. They don't want to get sleep. They don't want to get physically active. They're not going to the chiropractor. They're not going to pay attention to their teeth. They're not going to take a look at all the environmental toxins in their life. They're just going to say, let me swallow a couple pharmaceuticals and go with it. And unfortunately, it's a failure.
Okay, so let's talk about the medication that someone might be on. If they're on, antihypertensives, or if they're on statins, or they're on beta blockers, they go and see someone like yourself, and then you do an evaluation, and then you determine how they're going to get off certain medications. So someone's listening to the show now, and actually 40% of our listenership is in the US, which is exponentially growing, which has been incredible. But tell me, where do they start with the medication? Which is the most important that they can get off? Because I think this is fundamentally important. They're scared. Do they stop the statin? The previous doctor says you stop the statin, you're going to have a stroke, you're going to have a heart attack. How do they do this?
Well, certainly they're best off under the guidance of a holistic provider. So, certainly to qualify my answers to say, hey, listen, don't stop any pharmaceuticals based on our conversation. But I will say that when someone comes to see me, it's very easy to immediately stop a statin drug. You're on a statin for your cholesterol or whatever other purported reason why you're on it. And that's something that's very easy to stop immediately. Blood pressure pharmaceuticals take a little more time, a little more nuance. But again, it's able to be done quickly. But again, it's just not an immediate stoppage because, again, we want to get people as healthy as possible while we're reducing these pharmaceuticals. So again, they're, if someone's on 3 blood pressure pharmaceuticals and you were to stop them abruptly, well, of course, you may turn a 130 top number systolic blood pressure, and you may turn that into a 190, where that could be a potential problem. But again, as we start to introduce these lifestyle concepts, the nutrition concepts, then again, we're able to have people monitor their blood pressure. And if their blood pressure, again, is under decent control, then we can start to continue to reduce those pharmaceuticals, and it works. But as far as, sometimes, again, statin drugs, that's just a quick, very quick, stop and say, okay, we're stopping it immediately. We're starting this program. And again, Steve, when we measure people's levels 3 to 4 months down the road on this newfound plan that we teach, invariably people are doing much better. And if they're not, again, we need to continue to search for the why. Why are they still having issues? The why is not a pharmaceutical deficiency, right? No one was born with a deficiency of aspirin or statins or blood pressure drugs. We always have to continue to peel back the onion and go deeper, looking at why people are struggling. But again, as we solve that, that's when people live their longest and live their best.
So we've got, I think, 3 health coaches on our team that have been really beneficial. What's happened to your results, your long-term results, your transformation in people's lives, incorporating health coaches into your practice, that walk a journey with the patient? I think the biggest chasm there is between the practitioner, a cardiologist or a specialist, and the patient themselves. Sometimes you won't see the cardiologist maybe for 3 months and reassess the bloods or the labs or the testing. But the health coach, the role of the health coach, how important is that, and how has it improved your results?
The health coaches are absolutely tremendous. And again, I've got a great team of brilliant people working with me who really care, which is, of course, a fundamental factor when it comes to being a healer, to really, really care about the condition of the patient. I think so many medical doctors have lost that personal approach and personal care with people, and people just tend to become numbers after a while because most of these medical doctors are so busy. I think really the coaches exceed because of 2 things. Number one, the educational process. They're able to continue the educational process with the person as to how to live, how to eat, what things to avoid, what things to embrace, how to take supplements, when to get tested. They're able to provide that educational approach. And then maybe even more important is the accountability process, because we all have times of struggles. We all have times when we fall off the wagon, if you will. And the coach is providing that accountability of, okay, we have a meeting every 2 weeks and we're going to talk for 30 minutes every 2 weeks and make sure that you're on track. One of the most successful models of this, of course, is something like Alcoholics Anonymous. If you work with Alcoholics Anonymous, your success of getting through the alcohol addiction is very, very high compared to if you were to try and go at it alone. That is very well proven. And again, it's that accountability factor where you are reporting back to someone is there to make sure that you're adhering to the lifestyle. And again, that's where the coaches really excel. And for myself as a kind of the solo cardiologist in the program right now, it's difficult again to be able to to touch every patient frequently enough to make them accountable. And yes, I've got videos, and yes, I've got books and ebooks and material for people to read. But again, that's where really having that comprehensive team approach makes us successful.
Okay, so I need a bit of advice from you, Jack. Generally the specialists, the cardiologists, the integrative medical practitioners, they have not embraced using health coaches in their practices. It almost seems that if the cardiologist or the specialist doesn't recommend the health coach or incorporate the health coach in their initial program and pricing, then the patients do not take that health coach on. So a little bit of advice for us in South Africa: how do we embrace, the health coach within an integrative practice?
Well, I think that the practitioners really have to understand that if they have not used a health coach, how they can be beneficial. So inside of a medical model, I think the medical doctors are very familiar with the concept of a dietitian or a nutritionist, and they can kind of wrap their head around that. So I think if we can get more of the medical community to understand exactly what the training is of the health coach, what the wheelhouse of the health coach is, how they really expand so much more than just nutrition. And truly, again, if people want the best results for their patients, then this is what they're going to gravitate towards. But I think ultimately one factor maybe, Steve, is that the medical doctors, really their model relies on people being sick. When people like you and I and health coaches make people healthy, now we don't need to go to medical doctors anymore, save for emergencies. So what does that do to the revenue stream of the general practitioner that relies on so-and-so coming in every 3 months for a blood pressure check? And now I get, again, their insurance payment, I get the copay, and I just refill their pharmaceuticals. And that's my model of why these people are so busy. That's why these cardiologists are all so busy, again, because they just sit there and see people in perpetuity. The people's health never changes. They stay on the pharmaceuticals. Hey, how you doing? Blood pressure looks good, stay on your blood pressure meds. Cholesterol looks good, stay on your cholesterol meds. It's time for your annual stress test. Make sure to get an echocardiogram. Time for an angiogram. Time for a CT scan. That's just the medical model, of course, that I practiced for 16 years. I was inside of that industry. I'm the ultimate insider. And again, we have to also, when we're approaching people like this, trying to introduce our model, we have to understand where they're going to be coming from. That ultimately, yes, they want good patient outcomes, but ultimately they got to pay their bills.
So what gave you to see the light, Jack? I mean, how did you make your own transformation? It sounds 16 years in that model, and suddenly you're the natural health doctor, and you're starting to not just prescribe pills, but you want really transformation in the people's lives. What was the big change?
Well, ultimately, listen, I mean, I tell my story very well in my book, about, myself meeting my wife. And at the time I was a hospital-based cardiologist with sickness all around me, just so many patients, so much sickness, so much disease, so much death. And at the same time, also, I saw illness in my own family, with my father dying of a rare neurologic disease in his early 60s. And the Mayo Clinic in the United States says, well, we have no idea why your father's sick. We've got no treatment. He'll be dead within 3 years. And then I meet this young 20-something-year-old chiropractor, and she said, I'll tell you exactly why your father's sick. Again, getting into food, lifestyle, environmental toxins, and so on and so forth. So once I saw again the sickness in my father, I didn't want that to be me. And then also again, when I saw what we can offer really to our patients to really get them better, then that's what ultimately would cause me to leave the biggest cardiology group in the state of Arizona and start my own company, Natural Heart Doctor. And it's been incredible. And like you said, there's other cardiologists that are out there doing what we do. I happen to think that I'm the best of the bunch. I happen to think that I talk the talk and walk the walk more so than anybody. And I think from that leadership standpoint and the longevity that I've had with this, I think it makes me, again, one of the best in the field. But the more and more people we can get to embrace this kind of model, that's really how we're going to really change the face of healthcare, the face of the planet, and get people to live long and live well.
Great. Let's go into the weeds on nutrition. Let's talk about the carnivore diet and meat. I had SteveStavs, who spoke about glyphosate. It was an incredible show, and she's a world-class MIT professor looking at, the glyphosate, its impact, and she believes that's a real huge role in terms of the pandemic. But should someone be eating any industrialized meat at all?
Never. No, I never eat any animal unless it is known to be grass-fed, grass-finished. There's no scenario where, again, I would eat an animal product that is not in that area, because number one, because of the health of the animal and animal cruelty, the health of the planet, and then also obviously how that leads to health issues inside of the human. So no, there's no scenario where I would do that. And again, the beauty of it is that the more we support these grass-fed, grass-finished farmers from the United States, from Australia, from New Zealand, from again, all over the world, the more we support, the more of them will come online. So I think that's a huge factor. I'm a huge meat eater. I'm a huge nose to tail eater. You mentioned carnivore, and I do like eating animal foods, but ultimately I'm not carnivore. I'm a paleo guy. I'm a hunter-gatherer, which our ancestors have been for millions of years. So that being said, I think that when people kind of embrace that carnivore-ish model, they miss out on the most important food of all, which is seafood. So yes, we want to eat nose to tail, but we also want to eat I guess mouth to tail in the case of a fish. And the more seafood we eat, the longer we live. The more shellfish we eat, the longer we live. So kind of embracing that. If we think about the pyramid model of food, and we think about kind of animal based at the bottom, well, half is nose to tail land animals, and the other 50% of the base of that pyramid is eating seafood. And
that seafood, Jack, is wild caught, not farm fed seafood. Is that really important? Would you eat a farm fish, or farmed salmon, or farmed tuna?
Well, I think, I guess the quick answer is that make it wild, but wild seafood can be difficult in some areas to procure. So there are sustainable fisheries that are out there. So for example, off the coast of Scotland or off of Norway, it is, I guess, technically farmed fish, but they are out in the ocean, but they are inside of nets where they have better control over that. But again, they're not feeding them, as you mentioned, artificial colors, artificial grains. They're not dropping antibiotics into the water, but they are in some kind of confined area. But whenever we can go with wild salmon, sardines, anchovies, the shellfish, those are going to be our best strategies. And what's most important about those, again, is those omega-3s. We mentioned this before, that the people with the highest level of omega-3 naturally in their blood, and we measure those on people, the people with the highest levels have the lowest risk of everything, including the pandemic illness, including, cardiovascular things, heart attack, stroke, atrial fibrillation. So again, the seafood story to me sometimes gets missed out in the carnivore communities. And I think it's a mistake.
We're starting to also assess, probably the last year, it's just come to South Africa, the ratio of omega-6 to omega-3. Most patients, 25 to 1, really low omega-3s, high omega-6s. a lot of research been looking at the high levels of omega-6 causing, insulin resistance and causing insulin to increase, not only the high carbohydrate and refined. How important it is to do that test for your patients. What value do you place on the ratio, and what value do you place on the volume of the different? Is a high omega-3 really important, even if your omega-6s are high? Or how do you interpret that important test?
Well, as you pointed out, a lot of those seed oils, canola oil, and others, of course, are very high in omega-6. So those are not Paleolithic foods. They're not hunter-gatherer foods that our ancestors were consuming. We were consuming omega-3 from land animals, but certainly omega-3s from the sea. And just any way we can increase our omega-3 intake, and by doing so, typically omega-6s are going to come down because we're just not consuming those foods. So we do check those ratios on everybody. We do check the omega-3 index on everybody. And I think it's important to be able to show people the data and say, okay, listen, this is a printout of exactly where you stand. These are objective measurements, so you can see where the problem is. So as Dr. Seneff talks about glyphosate, if we can show people that their levels of glyphosate are very high, and make people understand that 60 years ago, their levels of glyphosate would have been 0.00, and any level above that is a problem. But again, to be able to show people, hey, this is objective evidence that you are being poisoned. And when you're being poisoned, these are the ramifications of that. So what we need to do, let's stop the poisoning, and let's also come up with strategies to, understanding that poison is inevitable on a 21st century planet. How do we upgrade our detoxification systems to get that poison out?
I did have Dr. Levy, the cardiologist, speaking on the show, which is an incredible show, and how important mouth health is. All the research going in terms of what developing atherosclerosis. In Dr. Jack Wolfson, as the cardiologist, what causes atherosclerosis?
What causes? I mean, the answer is everything. I mean, everything bad, leads to atherosclerosis, and so many different factors. But ultimately, if we think about inflammation, oxidative stress would be kind of the proximate thing that ultimately leads to atherosclerosis, aka plaque deposition, coronary artery disease that could subsequently rupture, leading to heart attack and or death. So all cardiologists know that inflammation is bad. Inflammation is, again, linked to every disease. But now it's a matter of, okay, how do we deal with inflammation? Well, from a pharmaceutical standpoint, they'll say aspirin and statin drugs and so on and so forth. In a holistic realm, we want to figure out what is leading to that inflammation. And unfortunately, what leads to inflammation is limitless, right? It is all these environmental toxins. It is all the bad nutrition. It is all the bad lifestyle, the lack of sleep, the lack of sunshine, the lack of physical activity. It is the mental and emotional illness of so many people that, again, leads to inflammation. And then back to, what Dr. Levy talks about, certainly we know this from Weston A. Price, a dentist who explored the world in the 1920s, that again, this, oral health was linked to disease. And again, that is very clear in the medical literature, that when the poor oral health, which ultimately is just another source of inflammation, that ultimately will lead to cardiovascular disease. So, dental health is extremely important. So we tell people, again, make sure you're under holistic dental care, eat the right foods, live the right lifestyle. And that's how we're going to achieve ultimate oral health. And that's also educational for our children, to be able to go back to them and say, hey, listen, this is why we eat the way we do, why we live the way we do. It's very important to take care of your mouth. Periodontal disease, again, is thousands and thousands of studies showing how periodontal disease, gum inflammation, gingivitis leads to cardiovascular events. There's been a lot of talk, certainly, about metal amalgams, mercury in those amalgams, definitely a problem. The root canal tooth, overt dental infections, dental implants. There's not quite as much, actually not even nearly as much literature on that as there is on periodontal disease. But nonetheless, I think we can, certainly make the case and say, hey, listen, again, ultimately oral health leads to systemic health, and you better achieve it.
Great. Now let's look at just what labs people can do. Inflammation, most people know is bad. Are you doing the standard HSCRP? Are you doing, your reverse T3 to T3 ratio? Are you looking at, liver enzymes? How does someone know? Because, I get a person who's a vegan comes in, says, listen, for ethical, spiritual reasons, they're eating this vegan diet. Their glucose is pretty much stabilized, no high blood pressure, really good muscle bulk, really good, athletic performance, but is on this vegan diet. What sort of labs do you look at from an inflammatory point of view, which I think is crucial that almost every single person does to assess their inflammation?
Yeah, it's so often, obviously, in the cardiology world, we're always talking about, well, what's the cholesterol? What's the LDL? What's the HDL? What are those ratios? But actually, that information is not very important, certainly in the face of and compared to inflammation. So as you know, there's so many different markers out there right now for inflammation. The most famous and the most amount of literature, as you said, is the HSCRP. And again, I'm not saying it's the best marker, but it's the marker with the most amount of literature. And again, for every point your HSCRP goes up, so does your risk. And again, it's about finding why are you so inflamed is really what the ultimate key is. But we check HSCRP, myeloperoxidase, oxidized LDL is a marker of oxidized or damaged LDL particles. LDL is a phenomenal molecule that all mammals make, and it's been in our evolutionary history for millions and millions of years. And ultimately, again, it's about, we want to have good, high quality LDL particles, and we don't want to have the small, dense, oxidized ones, and those can be measured. So again, there are literally dozens and dozens of markers that we could talk about, but I think ideally, again, we do have at least 3 or 4 of those markers that are checked on people, and then again, we institute a plan and follow up on the plan. 3 months later, we check and we see how we're doing.
Great. Let's take a little shift in terms. I had Dr. Peter McCullough on the show talking about what's happening with myocarditis, perimyocarditis in the pandemic. Obviously, now very prevalent with the jab. Are you seeing more young people with myocarditis, perimyocarditis? What is happening, in this pandemic with people's heart health?
Yeah, I definitely have seen several people with myocarditis. I've been contacted by a lot of people to help in their recovery. Certainly from the jab, I've seen heart attacks, I've seen strokes, I've seen a cardiac arrest, I've seen low testosterone, I've seen Bell's palsy, I've seen lots of atrial fibrillation, lots of PACs, PVCs, people that have not had atrial fibrillation in years. Who did get the jab and now are in atrial fibrillation. Again, because the purported reason why somebody would get a vaccine, for example, is to generate an immune response. And when you generate an immune response, that also is associated with inflammation. It's just the way the body works. So if you have this high immunoactivity and you have this high amount of inflammation, you're going to get atrial fibrillation. You're going to get the propensity for plaque rupture. And again, you're going to lead to some degree of muscle inflammation, because as the immune system is now in overdrive, it's going to inflame the heart muscle in a significant portion of people. And it's unfortunate. Now, the other side would say, well, listen, the risk of myocarditis is much higher if you don't get the jab than if you did. But again, that should be someone's individual decision, and it should be an informed consent. It should never be, in my mind, certainly, something that is mandated. But it's clearly what we need to do, I think, as a society and as a world, is really, again, how do we optimize ourselves physically? And that will be our best strategy to combat whatever nature throws at us in the future, whatever man-made is thrown at us in the future. Our bodies are built to withstand it if we give it the right tools.
Okay, so just to summarize that, Jack, is you've seen a lot of side effects from the jab, heart health, myocarditis, people have really struggled, stroke, neurological conditions. You've seen it in your practice. You've seen it escalate. You've seen an exponential growth in that, and you're on the ground. You're seeing a lot of patients. Just because I think it's a lot of it's in the literature, or it's been reported on VAERS, but actually people haven't heard it or seen it, or had an event within their families or friends. So people are thinking that there's no side effects from this jab. So it's just good to hear. I mean, obviously it's not great for those patients, but this thing is real. The side effects are real.
Let me say this again. I have a patient who, someone who's become a patient over the last 8 or 9 months. And he was under the care of a cardiologist, and he had an internal cardiac defibrillator in place. So a defibrillator is a device that's, again, attached to the inside of the heart, and it monitors the heart rhythm. And if the heart goes out of rhythm, or the heart it stops, well, instead of somebody coming from the outside with paddles, if you're able to find that person to, resuscitate that person, well, this is done internally. Now, this gentleman, who is actually a physician, had the defibrillator placed over 1 year earlier. And for 1 year, the device never was activated. It never went off. It never internally shocked that person. 3 days after his one and only shot, which was the Pfizer shot, 3 days after, he went into cardiac arrest, and the device worked, and it internally defibrillated him and essentially brought him back to life. So for an entire year, the device doesn't go off. 3 days afterwards, after the shot, the device goes off. He mentioned it to his cardiologist, and the cardiologist said, no relation.
Sure.
And again, so now that's just another example of something that doesn't go reported to VAERS, because nobody ever reported it. And that's why we all understand that what gets reported to VAERS is just a tiny, tiny fraction of the reality of what's happening out there.
Just to augment Peter McCullough, he just said, in no situation at all, someone under the age of 30, the risk is far greater than the benefit of getting the jab. Would you reiterate and say there's almost zero risk for people under the age of 30? And the reason I say that, of course, we want informed consent. Everybody's got an own choice to receive the jab or not. But for the young people that, they're not informed, they listen to their parents, or, they're very naive in the medical world. They've just followed the public health system. Should someone under the age of 30 be getting this jab?
Well, personally, I don't think anybody should be getting the jab. So that's kind of my take on it. Again, my approach is always about giving the body what it needs, take away what it doesn't. That's our strategy. Now, again, to the children, well, the rhetoric is going to be, sure, the children aren't suffering, but again, they may, according to the CDC, the risk of a 5 to 11-year-old being hospitalized was 1 in 100,000. That's nothing. 1 in 100,000 on a weekly basis were being hospitalized in that age group. So how can you take an experimental shot and apply that to people? Well, it became, well, we're not doing it to the children, but we're injecting the children so they don't infect the immunocompromised or the elderly. So it's about protecting our elders. So again, that's the rhetoric, that's the debate that's out there. But you know what? I'm not going to light myself on fire to keep you warm. That's always been my approach. Again, if you have multiple risk factors, if you are in a nursing home with these multiple risk factors on multiple pharmaceuticals, your best bet, if you're concerned, is to stay home, stay locked up, stay safe. Let the rest of the world continue on the way that it should. And that would have been my approach from day one, is that, hey, no matter what this is, if you're concerned, you stay home. The rest of us are going out and living our lives.
Correct. I want to go to your own daily and weekly protocols. Obviously I'm really happy with people taking more accountability of their health. Apple bringing out the new watch that's going to measure glucose, people are able to measure their blood pressure. There's a lot of accountability that people are taking, which I'm very excited, and different sort of online communities keeping people accountable with exercise. But in your life on a daily basis, what does it look like? On a weekly basis, what does it look like from your own sort of biohacks that you do, whether it's outdoor living, which I know you're living in a state that you spend a lot of time outdoor with your kids and you really do walk the talk. But what does your lifestyle look like if someone's like looking at the patio cardiologist who's going to have 100-year-old heart? What does it look like?
Well, once again, it's just trying to live as natural as possible. And it's not easy. Listen, in a modern world, again, there's so many different demands. We've got work, we've got family, we've got, again, just, so much that we're all trying to accomplish. And I'm not saying that it's easy, but, certainly some of the things that I personally, control in our house, we always go to sleep shortly after the sundown and we wake up before the sunrise. We try and watch the sunrise and sunset as much as possible. We try and spend time every single day outdoors and preferably in the sun. We eat only organic food and we eat a lot of free-range grass-fed meats and wild seafood. We keep our environment as pristine as possible, again, with just the healthiest personal care products, the healthiest products in our home, air purification. We try and, again, just lead that ultimate existence. And ultimately just find love and joy in our family and in our friends and our relationships. And a lot of our family and relationships have changed certainly over many years, but especially over the last couple years as we gravitate towards people who believe the same way. And that's part of our emotional health as well, to be able to associate and live with people that are congruent with us and really distance ourselves from people who don't. So again, we just try and live as much as we can with nature in a 21st century world. And that's the best approach. Listen, I wake up and I take supplements. I take supplements with my lunch. I take supplements with my dinner. I do believe that supplements supplement the healthy lifestyle, and that's our best strategy to stay healthy. And again, that's based on laboratory testing that I do on myself. If I see that my inflammation's high, well, I want to know why. And, did I fall off the diet in any way? Did I eat too much sugar? Is there something in my environment now that's intoxicating me? Is it, again, mold mycotoxicity is something that deserves its own show. And I hope that you have opportunity to delve into mold mycotoxins and all the things that, that does. I'm doing a webinar for 1,000 practitioners coming up next Thursday, specifically about mold mycotoxins and cardiovascular disease. Major problem.
Wow. Okay, so let's maybe push you a little bit. What biohacks do you do? Do you use red light, and what do your supplements look like? Because people are going to really want to know what. I think you're on a road to living maybe to the Dave Asprey 150 or 180. Having instituted a lot of these things early. But tell us about your supplements, your exercise. You believe in cardio. You believe in weight training. You believe in maintaining your muscle mass.
Yeah, most certainly. Again, as far as like some of the biohacks that a lot of people, whether it's Dave Asprey would get into, and others about, red light therapy and saunas, photobiomodulation. Again, there's so many different things that people can do. I mean, for one, I'm under chiropractic care. That's foundational for me. Again, the sleep, the sun, the basics, physical activity. In the wintertime, we ski and we're active outdoors. In the summertime, stand-up paddleboard and kayak and hiking, and I'm a huge mountain biker. So I do love the idea of making exercise and physical activity fun. And and I think that's the ultimate strategy. The evidence in the medical literature tells us that high intensity interval training is the healthiest for us, as opposed to 45 minutes on a treadmill inside in the artificial light with all the chemicals and electromagnetic radiation coming from all these different treadmills and devices. So the more we can do it outside, do it naturally, I think is absolutely critical. You did mention the Apple Watch and stuff like that. I just like, and I know you do as well, caution people about wearable technology. It is a source of EMF I think it's okay to use on occasion, but it's not something that I certainly would ever do, is kind of any kind of wearable technology on a consistent basis. Again, if you're looking to say, okay, well, I got this Aura ring to see what my heart rate variability is, I've got no problem with doing that for, for a finite period of time, 12 hours, 24 hours. But again, the wearable technology, I think, is a problem and should not be embraced. If you take your EMF meter, if you take your trimeter, for example, and you put that up into an Apple Watch or your other wearable technology, you'll see that the amount of EMF generated from those devices is absolutely scary. And in our house, again, we turn off the power as much as possible. We again, all of our we try and really shield ourselves from a lot of the EMF coming from some of these sources, and it's absolutely critical. Martin Paul is a fantastic PhD researcher on the subject of EMF, and certainly as it pertains to cardiovascular. But when we check someone's EKG, we're checking the electrical system of the heart. And to think that man-made electromagnetic fields doesn't impact with the electrical fields of the human is obviously foolish.
Okay, just wrapping up on the show, we're coming to the end. You've obviously got it sounds like an incredible relationship with your wife and your family. And what is your spiritual health like, and how important that is? And maybe you want to just give a message of hope. A lot of people are in despair. A lot of people have gone through suffering and loss. I thought that suffering and loss was going to help people kickstart their transformational health journey. And it doesn't seem to be. They seem to be very, very down. There's a lot of depression, floating anxiety, and looking at Professor Desmet and this mass formation psychosis that people have been caught up in over the last 2 years. How important is our spiritual health, our relationships, and maybe a message of hope for the community?
It's as important as anything else. Again, as we look to, we're always debating about food. And then again, we'll talk about sunshine and sleep and physical activity and a healthy lifestyle. And then we can dive into environmental toxins and pollutants. But again, the mental health, the emotional health is just as important as anything else. Fear, social isolation, anger, anxiety, depression. These are in the medical literature proven to be linked to a markedly higher risk of cardiovascular death. So we need to, again, show people that in this 21st century world, that those spiritual connections, being in touch with your tribe, being around like-minded people is absolutely paramount. And unfortunately, the controllers don't want that. They want us socially isolated. They wanted it from the beginning. Stay at home. They want us impersonalized by masking us and putting masks on the children, which is nothing short of child abuse. So we really need to embrace the connections that we have, the positive ones. We need to get rid of the negative connections. And then again, whatever your spirituality is, I think that should be embraced as well. So whatever your faith is, whatever you believe is our creator, or you believe that that the future is going to be better. I certainly want to maintain that positivity as much as possible. But at the end of the day, keep your close relationships close. Really foster those, encourage those. Understand that again, your tribe undoubtedly shrank in a lot of ways, but it could also expand. And when you talk to people like you and I, Steve, and others like us, that's your new tribe, and embrace it.
Great. Well, you've got a tribe here, the Made to Thrive tribe, the community here in South Africa and abroad. You've got a home here in Johannesburg that you can visit. We can send you out on safari here. Africa offers unique experiences that possibly the Americas don't. So I just declare favor and blessing over you. Once again, thank you for your education. And I really appreciate your calling and your courage. You're a man of truth, a man of much courage to speak up as a board-certified cardiologist in this space and time. And just thank you for your podcast. And we'll put the links to your website and the courses you do. And if they're the reruns and people can get it, obviously the time difference is significant from Johannesburg, I think, to Arizona. But I really want to just salute you and I declare that you would carry on. You would be the 100-year-old cardiologist that is still seeing patients, still working, still educating, and so I just want to I'm just very grateful for people like yourself.
I appreciate the opportunity, Steve. Pleasure to talk to you again. And hopefully we'll get down there to Joburg, and then we'll head on to Kruger National Park and allow my kids to be able to see kind of what it's like to be out there, in the wild, in nature. And I appreciate the opportunity. We'll look forward to it.